Hi everyone, it's Dr. Lisa L. Campbell, and in this video, I would like to give you an orientation to the CPT 2025 Professional Edition. The first thing that I do want to call out is that the CPT manual is the copyright of the American Medical Association. So at the very top, you see their logo listed. They are responsible and own this manual. The AMA, and I'll use the abbreviation going forward, annually updates the code sets within CPT, and the new codes become effective January 1 of each year. These codes are 5 digits in length, and they're used by providers, and a provider is physician, nurse practitioner, physician assistant, just to name a few, and outpatient hospitals to convey what happened to a patient during an encounter. To give you a comparison, the ICD-10-CM diagnostic code sets explain what brought the patient in, so the why. CPT shows what happened today. ICD-10-CM shows why. I think one of the biggest challenges with using this manual is taking the words that the provider documented and translating it into a CPT code. So it is very important that you understand the contents of this manual, which is really my focus for this video. So current procedural terminology, we commonly just say CPT manual or CPT codebook. You will hear it used interchangeably. I do want to tell you that CPT has been around for a while. In fact, the first edition came out in 1966. And the whole purpose of this system is to provide a uniform way to show what happened on today. All right. So what you're looking at right now is the cover of the manual. And when you get to the inside cover of the manual, at the very top, what you're going to see are symbols that are used throughout the CPT manual. Now, when we report a code, we don't use the symbols. The symbols just provide us information. Immediately after that, you see a list of modifiers. I do want to call out that this first set of modifiers, 22 through 99, are modifiers that are used when we're reporting services for the provider. If we are reporting services for hospital outpatient, there are additional modifiers that we must use. Now, you will notice where it says modifiers, it says see Appendix A for definitions. And so let me scroll over on the table of contents. Appendix A gives us the full definition of the modifier. What you see here on the inside cover is just the title. So like 22, increased procedural services. In Appendix A, you'll actually see what the AMA means by increased procedural services. Okay, so there are other things here. I trust that you will take a look at them. On the opposite page of the inside cover, what you will see are place of service codes for professional claims. So these are 2-digit numbers that go on to the CMS 1500 claim form in block 11 that tells the insurance company where the service was rendered on today. Just to help bring this concept alive, I wanted to show you a little snippet of the claim form, and I've taken the liberty of circling 3 items on this claim form. So the first item that I circled is actually the column where that 2-digit place of service number goes. Then the second box that I have circled is the column where you can list up to 6 CPT codes. And then to the right of that column, the third circle is where we can list our CPT modifiers. Now, because I am just doing an introduction to the book right now, I'm not going to spend any additional time, but I just wanted to show you this visual because I'm a visual person and I'm sure you are as well. All right, so now the next page is the title page, and it's just like, any other book. So the CPT manual from there consists of, there's some other stuff here, but I'm going to go to what I want you to pay attention to. We have the table of contents, and in order to become familiar with the contents of the manual, you should use the manual and the table of contents to just become familiar with what's in the manual. Okay, before you can even use the manual, you really need to know what's inside of it. It's so very important. So the manual, if I had to sum it up, we have the introduction to the manual, which is right here, Roman numeral, I guess that's 14. And then on page 4, you have the main body of the book, which goes all the way over to page 983. And then after that, you have the appendices, and then you have the index. And the index is actually where the coding manual, where the coding process begins. Okay. So in the main portion of the manual, what you will see is what CPT refers to as category codes. So for example, just to simplify this, there are 3 categories in the CPT manual. So and I'm going to kind of go out of order just because I want to bring clarity. So you have category 3. Where's my little pen? Okay. So you have category 3. You have category 2. And then all of this here is category 1. So when we're coding, we primarily spend most of our time with category 1 codes. So that's why I did them last, because I wanted you to see. And you probably are saying, oh, well, they don't even say that it's category 1 there. Well, actually, when you read the introduction, they mention that there are 3 categories of codes. Okay. So as it relates to category 1, which is the largest portion, there are 6 sections of category 1 that you should be familiar with. Okay. So those 6 sections are evaluation and management, anesthesia, surgery, radiology, pathology and laboratory, and then medicine. These are the 6 sections of category 1. Each section is preceded by guidelines. So you see right in front of evaluation and management, which we shorten to say E&M, there are guidelines. In front of anesthesia section, you have guidelines. In front of surgery, you have guidelines. In front of radiology, you have guidelines. In front of pathology and laboratory, you have guidelines. In front of medicine, you have guidelines. So these guidelines are basically like your roadmap for using that particular section. But wait, there's more. So number one, the surgery section is the largest section of the CPT manual. And I'm almost done with this little introduction to the manual. So the surgery section is the largest section. And within all of the 6 sections, what you are going to see represented are additional notes. So the guidelines are in the beginning of that section. It applies to the entire section. But then within a section, you have what are known as subsection notes. Speaking of notes, as you're listening to this video, you are taking notes. You probably will need to listen to this video again because you're gonna miss something, right? Okay, so the section notes are at the very beginning. Those are called guidelines. Within the section, you have notes that are called subsection notes. So for this family of codes, fine needle aspiration, you see these notes that are listed here, right? And so you go through the section and you're seeing different symbols, the symbols that were at the very beginning of the book. They do define them at the bottom of the pages, but it's important that you know what they are. So in addition to the section guidelines, which are at the very beginning, the subsection notes that apply to a particular area. So I just showed you fine needle aspiration. Now I'm showing you biopsy. There are other notes that are underneath a code, and those are known as parenthetical notes. And the parenthetical notes tell you something that you need to know. So if you want to use, for example, 11103, the symbol up front will tell you that that plus sign is an add-on code. This is why you need to do a orientation of the manual before you even try to use it. You just need to understand it. It's telling you must report 11103 in conjunction with those other 3 codes, right? So it is something that cannot be used alone, but it can be used with 11102 or 11104, or that comma means or 11106. Okay. Let's see what else I want to tell you, and let me just recap. At the beginning of each section of category 1, there are 6 sections, you will find the guidelines. Inside of the sections, for particular subsections, and it's not all of them. So if you notice on the screen, pairing or cutting doesn't really have a big long paragraph, but biopsy does. And it just depends on what the AMA has deemed as something that needs to actually have the notes in front of them. So you have the section guidelines, you have the subsection notes in a particular subsection. Sub means below, under. Okay. Then you have parenthetical notes. Here's another one. Do not report 11042 through 11047 in conjunction with these codes. So one thing about coding, attention to detail is so very, very important. Coding is not something you can do when you're tired. It's not something you can do when you're in a rush, because there are attention to details that require your attention. All right, let me continue so I can wrap this up. There are other notes that you'll see in the manual, such as coding tips. Let's see if I can run across them. We're seeing more subsection notes. There's a lot of subsection notes in the manual, and you are not expected to memorize them all, but you do at some point, if you're going to take a coding exam, you need to read through them. Okay, so I'm not seeing what I'm looking for, and I don't want this video to be longer, but I do want to address the words that you're seeing in green. They're in green because they are new to this particular edition of the CPT manual, and that text is new. How do I know that? Well, number one, the words are in green. Number two, there is a left and right facing triangle that encloses the words that are in green. All right, so earlier I mentioned about the appendices and how Appendix A gives you a list of the modifiers. I mentioned to you that those first set of modifiers, 22 through 99, are reported by the provider. And then you have modifiers that are used by anesthesia providers. And then you have modifiers that are used for hospital outpatient use. All right, there's one last thing that I'm going to show you. I trust that you are going to spend some time just to lay eyes on the different sections. When you're first looking at the manual, don't try to take it all in. Just do an orientation to the manual so that you know where things are. So the last thing I want to show you is the index, because this is where the coding process begins. And I'm going to actually get to the index. So when I was working, when I was forced into coding, this doctor said to me, "Oh, this book is real easy to use because all you got to do is look things up in the dictionary portion of the manual." This dictionary portion is the appendix, or the index, I should say. It's the index, but it wasn't as easy as he said it would be. So the way that this index is organized is that there are words that are listed in blue, that are known as a main term. The terms that are listed underneath it are known as a subterm. So for example, the term ablation has several subterms underneath: anus, bone, breast, colon, cryosurgical. Okay. So when you are reading a medical record and you're trying to code a procedure, the first thing you're going to do is to determine what main term should you use. I will note in the beginning of the index, they actually talk about how you use the index and the main terms, which is why it's so important that before you even try to use the manual, that you just do this tour. Now you're going to do an expanded tour, right? This video is only 20 minutes long. You're going to do an expanded tour so that you can get to use it. Okay. So let's say the patient had an ablation of a tumor on the anus. So my main term is ablation. My subterm is anus. My carryover term is tumor. And the index gives me 46615. One rule of thumb: you can never, ever, ever, ever code from the index only. You must verify the number that you are provided. So when I click on 46615, or if I had a physical book and I was turning to it, I notice that 46615 says, with ablation of tumor or tumors meaning more than one, polyp or polyps, lesion or lesions, not amendable to removal by hot biopsy forceps, bipolar cautery, or snare technique. Now, you're probably looking at that sentence saying, why is that in a lowercase format? Well, that is because, and they talk about this in the index, discussion at the very beginning, which is why I want to emphasize this 20-minute video is not going to cover everything. You do have to spend some time looking around. So what CPT does is use this concept of a standalone code and an indented code. So just for discussion purposes, let me just highlight that 46600 is what is known as a standalone code. Notice that it is it has a capital letter A for anoscopy, and then it has the rest of the description. So what the AMA has done is, instead of reporting anoscopy, repeating the word over and over again, they just put it in a standalone code. And so if what was done is represented in 46600, that is the code that you report. However, if the patient had something that was in any of these indented codes, and let me just get this out of here 1 second. Okay. Then you will report one of those. And let me just be very clear, which is why I said you probably will need to repeat this. When you're reporting, and we were looking at initially the 46615, when you're reporting a code that is indented, it relies on the description of the standalone code up to the semicolon. No, you don't report both codes. This is how 46615 would read. Anoscopy, stop at the semicolon, with ablation of all this stuff that we said here. So instead of them repeating anoscopy here, anoscopy here, anoscopy here, here, what the AMA does is gives us that standalone code, and we're instructed to read the description of that standalone code up to the semicolon and then go back down and read the description of our code. That's a concept that takes a minute for your brain to really understand. So please ensure that you listen to this multiple times. Here's another example, and let me kind of just put a box around these two codes under repair. Okay, so notice 46700 and 46705 is anoplasty, plastic operation for a stricture. Notice 46705 is indented. Why? They are both codes for anoplasty, plastic operation for stricture. This is the code that you would report if it's for an adult. This is the code that you would report if it's an infant. So when you're reading an indented code, you do not report both codes. You just look at the description up to the semicolon in that standalone code. Let me do one more. Again, this is a concept that takes a minute for your brain to process, which is why I love videos, because you can watch it over and over again. So this is going to be my last thing, and then I'm going to end this video. So when the index sends you over to a code that is indented, you must go to the standalone code in that same code family and read the description up to the semicolon. So let's say we were using 46916, which says cryosurgery. You have to read the description of the standalone code. Destruction of lesions, anus, all the other stuff. Simple. Stop there where the semicolon is and go to cryosurgery. So essentially, all of these procedures are destruction of a lesion, but the unique code tells you how they did it. Remember, you're just looking at the description up to the semicolon. you're not reporting both codes. All right, I'm going to stop there. Thank you.